Right, so excited to bring this one to a lot of you because this is something I get asked about regularly and I don't get believed. Unfortunately, there's a lot of misinformation out there, and I've mentioned this before, but influencers and people with popular accounts who are selling you PCOS plans, well, they can take a hike. I'm just going to explain to you what the research consistently shows, and I will also cite this, so if anyone is interested in knowing where I'm getting this from, please reach out to me and I will send you the evidence, the citations rather. So PCOS in the South Asian community, prevalent as some of you will be aware. I just want to touch on a little bit about exactly how it kind of affects you and what actually works, right? So let's dive straight into it. So anyone wants this, let me know. I'll send this over to you. We created this just to kind of make this a lot easier for anyone, but essentially it's a hormonal disorder that for a lot of women they don't actually realize that they have cysts in their ovaries, and it can get diagnosed kind of later in life, I guess. That's kind of the gist of it. I had to sneeze there, I had to pause the video there. So that's essentially it. So a lot of people don't realize it later in life when they have trouble losing weight, for example, and you have a whole host of side effects as well. So irregular periods being a very common one, acne, hair loss, and all that sort of stuff as well. Insulin's a big one though. This is something that, yes, it does impact people, but it is not well understood. And a lot of South Asian women are looking for a supplement to fix it all. If you are someone who's not willing to do a little bit of exercise and just perhaps take a couple of minutes to listen to this, I wish you the very best, but this is not going to be for you, okay? If you want to, once and for all, fix this and not fix your PCOS, but manage the symptoms and be able to lose weight as we do every year with 50 to 70 ladies every single year, I'm going to share exactly what we do, okay? Very, very important. So again, I'll send this over to you as well, but the problem that we have from a cultural perspective is that we try remedies, holistic methods, and unfortunately, a lot of it isn't grounded in actual research, okay? It's very, very important that I stress that. I appreciate people's best efforts and they mean well online when they're explaining how to manage your symptoms. I'm not talking from a fertility perspective. I'm going to be talking from a fat loss, weight loss perspective, okay? Now, one of the most important things is losing at least 5 to 10% can massively, wildly improve your symptoms, okay? And it can significantly improve chances of fertility as well. But that's as far as I will say. I'm not an expert in that field. However, it begs the question, well, how do I do that when I struggle to lose weight? Okay, so again, I'll touch on that briefly. Now, nutrition, I'll touch on the Mediterranean thing there just now. Let me just quickly scroll down to nutrition. Now, nutrition is a very, very important one because when people are trying to build their food, I guess they're trying to remove dairy and gluten and stuff like that. There's no basis for it. Again, the evidence is limited, if not, absent altogether. From what I've seen and from what I've observed, the Mediterranean diet generally tends to work well. I'm sure some of you will already know all this anyway, so, the sensible stuff. It's basically a case of it's basically eating healthy, but limiting red meat. And a lot of meats generally, because I believe fish is quite prevalent in the Mediterranean diet. But I typically follow a Mediterranean diet for the most part because I feel better. I'll have chicken maybe once a week or twice a week. But generally, this is the stuff that I do. And I feel great. It feels awesome. And when I've got our clients who transition slightly over to a Mediterranean diet, we have found that they have lost weight with ease. We have found that they have managed to get pregnant. Okay, I'm not saying this is going to be the ultimate fix, no. But 80 to 90% of clients we've used this with, it has worked tremendously well, okay? Now, that does mean, obviously, roti salad and stuff can still be included, but you just got to be sensible. You got to be smart, okay? You just have to not cut it out, but limit it altogether, okay? So these are generally the kind of foods that work best, okay? Exercise is probably the biggest one. Cardio, yeah. I get told a lot about HIIT training being bad for you because it raises your cortisol, and now everyone's selling a cortisol lowering diet. Again, I don't know what the hell that is. No such thing exists. Cortisol is good for the body. Elevated, extreme levels of cortisol is not good. Okay, that's where you really need to understand. Cortisol is important because the body needs to know how to deal with stress. So we're looking for controlled stress, and in the form of strength training, that's the best one. Okay, lifting weights is the single best thing you can do because from a metabolic perspective, you'll be firing on all cylinders. And when you progressively overload, because remember, carbs and muscle are best friends as ever. If you are insulin sensitive, or if you're diagnosing yourself as insulin sensitive without, actually getting it checked, because a lot of people like to do self-diagnosis, you go on Dr. Google and have a look. Even if you don't, okay, if you're not concerned about it, lifting weights is the best thing for you, because when you have a buildup of sugars in the bloodstream, if you don't have enough muscle tissue in the body, it's going to sit there, and that's how diabetes develops. When we have seen people lift weights at least 2 to 3 times a week and get stronger, we have seen their symptoms improve. Okay, we have seen them lose weight with ease. So if you want one thing to take away from this, and you can just stop the video now, I would say strength training is the single best thing for anyone with PCOS who is trying to lose body fat. Because yes, insulin resistance is, I guess, a bit of an issue for people with PCOS, although I would argue not as big as people make it out to be, but it's still there. And in order to improve that and to, I guess, be healthier, lifting weights, it's an absolute no-brainer. Okay. You have holistic lifestyle approaches. So again, I won't really dive too much into this, but basic common sense, I guess. Good sleep hygiene, water, managing your stress, all stuff that is easier said than done. And again, supplements I'll touch on in a second, but I've mentioned vitamin D here because I consider it a lifestyle, because especially in the UK when we don't get enough sun here. But again, get your doctors to check your levels. Now, supplements is probably the biggest one here because there's a lot of nonsense out there. So first things first, the ones that I would speak to a GP without trying to even fix this yourself. When it comes to metformin or any sort of oral contraceptive, speak to your doctor. I've had people ask me this on Instagram, and I've told people to stop asking me this. Go to your doctor and stop going on Instagram. Okay? Now, the ones that I can touch on a little bit, but again, it would be wise to speak to a GP if you're unsure. Inositol, berberine, carnitine, vitamin D, and fish oil. Okay? Now, sorry to break it to you, but L-carnitine, load of rubbish. Okay? A caloric deficit is still required to lose body fat. So when you see the description on L-carnitine, its job, the company's job, is to sell you it. Okay? So when it says it will help you burn fat, well, outside of a calorie deficit, not possible at all. So please stop using this for PCOS. Okay? Inositol is probably the one that I have seen has worked the best, I guess, with people, and the research is quite solid. I will cite the PubMed citations for all of these if anybody wants them, okay? Just please reach out to me. But essentially, these are all just, I guess, insulin-improving ones, from inositol to berberine. And even vitamin D as well to some degree, but inositol seems to be one that a lot of people take, and for good reason. Okay, it's got the most evidence behind it. So what we generally found as well, I mean, I've mentioned it here, can improve insulin response, and can lower insulin resistance as well. We have seen clients who've managed to get a somewhat of a regular cycle back as well. But again, that's going to be in combination with some exercise and eating well as well. Okay, it's important you understand that, because supplements is something that I understand out of desperation, you're going to want to look for stuff, but really, if I'm going to suggest something, and again, speak to your doctor in the first instance, I would suggest basic vitamin D, omega-3 fats, and inositol. I mean, generally, that seems to work best for all of our clients over the last 11 years of doing this, and it's never failed anyone. Okay, hint, hint. So, myth busting 101, no single PCOS diet. If I can go on Instagram just now, if I type in PCOS, I will find the PCOS specialist, the PCOS expert, the PCOS nutritionist, and they're giving you a load of nonsense again. And when you reach out to them and ask them to give you any research or actual evidence behind those claims, they can't give it to you. Okay, so there's no one size fits all approach here, unfortunately. Gluten and dairy, again, I'm not sure where this came from, but again, out of desperation, it was created, and a lot of people have tried to follow this to no avail. There's no evidence behind this, so please do not do this, because it's actually going to remove more joy from your life. You know, like, essentially, if you want to fix your nutrition, just eat. I mean, if you want to stay on top of it, lower glycemic foods generally tend to work best. That's the one thing that I was still skeptical of until I read the research. And yeah, fruits and vegetables, and carbs that are going to be on the lower end, I guess, and the glycemic index are going to work best for you. Okay, I'm not going to go over this one. Fat burning teas, expensive, and cleanses don't even work, for goodness sake. The real secret: lift weights, increase your protein to 0.8 to 1 gram of protein per pound of body weight. So if you weigh around 150 pounds, anywhere between 130 to 150 grams of protein will work best for you. Eat more fiber, so lots of fruits and vegetables, especially those with the skin on. Sleep lots, okay, and move daily in any way. If you can do all of this, I can absolutely guarantee you will definitely be well on your way to losing more body fat, because you do this. This is the stuff that's actually working, but you got to be patient with it. Okay, so this is the stuff that works. So if anything, what I want you to take away from this is lift more weights, okay, safely, increase your protein, take maybe 2 supplements if you really want to, and eat more fruits and vegetables and follow a Mediterranean diet if you want, okay? And if you do that and you're consistent, you will lose weight, will then improve your symptoms of PCOS, and then obviously whatever else you're trying to achieve whilst dealing with PCOS, I'm fairly certain those things will come about, okay? So that's all you need to know. Well, but what do I know? We have a small page on Instagram, and I'm a male. What do we know about people with PCOS? Well, you're right. I don't know myself directly, but I've been in this for about 11 years now, and I have done all the research. I've checked everything. I've fact-checked everything that I speak about, and this is the approach that we take with all our clients. I've dealt with, out of the clients that we work with, at least 200 of them have had PCOS over the last 10 years, okay? And I would probably say every single one of them who stuck through it lost the weight, and a large volume of them were able to get pregnant as well. Okay, so yeah, there you go. Proof is in the pudding. Any questions at all, please let me know, and I'll be more than happy to send over any of the research and citations, because at the end of the day, I'm not going to say any of this and not back it up. Thanks for watching, folks.